Right.
Hey, everybody.
Hey, good morning.
How you doing?
Good. How about you?
Good morning, everyone. Thank you,
Hi,
Senator, for
Senator.
joining us.
Of course. You guys started at 8 o'clock. All right.
Yeah.
Cool.
Boom. We're ready.
Hi,
So-
Mike King. It's Diane. Hi, how are you?
Oh, hey, Diane, good to hear from you.
Is Serber too old to get up this early, or is he on?
He's on.
He's
I don't
on.
see him. Okay.
Oh,
I'm old. Let me just tell you Serber's. Can I tell you a Serber story before we start?
Absolutely.
So
Yeah.
I've known Serber I've known him so long. He was a young Democrat, if you recall. And back before he went over, as most of you are. Anyway, I remember him telling me when he helped in my first campaign about the Great Darke County Fair. And I don't know if that was its official title, Great Darke County Fair then, but he told me all summer it's the best fair in the state. And I thought, yeah. And so if I recall, the fair was in late August. So I'd go to fairs in June and July, and then people kept talking about it, and he was right. So anyway, I give him credit there.
Well, good. Yeah. He waves our banner well for us. So,
Yeah, he does.
well, I think we're going to get started. So, again, thank you for joining us. Good morning, everyone. My name is Katie DeLand, and welcome to the Darke County Chamber of Commerce's monthly legislative subcommittee. We meet every month, and this month we are so thrilled and honored to be joined by our United States Senator, Sherrod Brown. I'm going to give you a little bit of background. I know a lot of you obviously know our esteemed senator, but he's got an extensive history, and it's so interesting. Senator Brown was born in Mansfield, Ohio, and is the proud descendant of Scottish, Irish, German, and English ancestors. He majored in Russian studies at Yale University and received a Master's of Arts degree in education and an MPA from the Ohio State University. Senator Brown's political career began early as he was recruited during his senior year of undergrad at Ohio State, and he ran for the Ohio State House. He won, and at that time, he was the youngest person elected to the body. As we all know now, that was just the start of a very tenured career. Mr. Brown went on to serve as Secretary of State, a United States Congressman, and since 2007 as our United States Senator. Senator Brown currently serves on several powerful committees in Washington, including the Committee on Finance, Committee on Veterans Affairs, Committee on Ag, Nutrition, and Forestry, and most notably as the chairman of the Committee on Banking, Housing, and Urban Affairs. Welcome, Senator Brown, back to Darke County, although virtually. We appreciate your time, and we're so excited for many of our business leaders. As you can see, we have a great deal of people that are excited to talk to you today. And so we're actually going to open it up first with 4 different industry leaders that are going to kind of give you some perspective and insight on their respective bubbles here in Darke County. And I think that'll help set the stage for our call today. So Mike Farron, Jason Kirshner, Christy Strasser, and Dr. Doreen Larson are all members of our legislative subcommittee. And Mike, we're actually going to start with him on his perspective in agriculture. So thank you, and Mike, we'll turn it over to you.
Kathleen,
thanks, Katie, and Senator Brown, thanks so much for taking some time with us today.
Of course.
Mike Farron's my name, owner of the Graves Farron Insurance Agency in Arcanum. Work primarily with farmers in the area with farm and crop insurance. And in our county here, last year in 21, farmers enjoyed a good year of good weather, good prices, and good yields. And so it was a good year in 21. As we look forward to 22, a lot of uncertainty out there. As you know, with increased costs of inputs, fertilizer and diesel fuel, seed corn, seed beans, all those things that farmers use to get the crop in the field and to produce that crop have in many cases doubled or tripled in their cost for their input cost. So that's weighing heavily on our area growers, not only in Ohio, but across the country. And so that's something that they're definitely, working through right now. Fortunately, commodity prices are very good, but lots of uncertainty there. And the activities that started last night in Ukraine certainly exasperate that, with increased costs of fuel and those things to be concerned about. but also the commodity markets, are probably going to be very volatile here. So that certainly is weighing heavily on them. And with increased input costs, as long as the prices that they receive for the commodities are high, they're okay. But we can all, estimate how volatile of a roller coaster those commodity prices may be over the course of the next 12 to 24 months, and that's something certainly weighing heavily on them. Many growers in the area, most actually probably have prepaid for their fertilizer and those kinds of inputs last year when they forecasted this coming. So many of them are most likely in a decent position this year. But as you look forward to 2023, if those input costs continue to be high, that's certainly a concern for them. For some growers that have not purchased their inputs, and in particular fertilizer, they're finding that hard, not only hard to afford, but hard to obtain and even get through the supply chain. The other thing affecting them would be equipment costs, are certainly increasing, and the availability of equipment is probably even more crucial to them. The availability of parts and those kind of things through the challenges we've had with the supply chain. So those are some of the things weighing on them, but spirits are good here. We've got some great farmers and growers in the area that all do a great job and are able to work through some of those issues. I would also mention the federal crop insurance program continues to be a vital part to their operations and very important to them. So I would just mention that farmers and growers in the area utilize that program, and certainly it's a necessity as they manage their risk year in and year out. So that's what I have, Katie, and I'll pass it on to the next person.
Katie, can I make a couple comments about each person or respond, or does that make sense?
Hey,
Sure. A couple things. First, you mentioned, thank you, Mike. And I've sat on the Senate Agriculture Committee. There hadn't been an Ohio senator in the Agriculture Committee in like 50 years. I'm not sure why. And I've been on that committee my entire time. We've done a number of things on crop insurance together with the industry and making sure the dollars are there for crop insurance, how important that is, and a number of other. Within this year, we begin the way I kind of run this off. Well, the way we run this office is I do a lot of roundtables like this, where I don't do like some of my colleagues, these big town halls where people just scream at each other about all kinds of issues. I try to focus with smaller groups where I can hear substantive things like you just said, and then we sort of gather information on what we're doing on the farm bill, and then every 5 years the Congress writes a new farm, every 5 or 6 years, and we'll be working on it this year and writing it in 2023. So work with us on those issues. That would be really helpful. On Ukraine, you brought up Ukraine. It's a terrible, terrible thing. I mean, Putin is a autocrat. He's a dictator of the worst kind. There's nothing. I mean, it's clear what he wants. He wants Ukraine to be part of the old Soviet Union, essentially, old Mother Russia. The good news is that, with the exception of that Biden and Republican leadership in the House and Republican leadership in the Senate are all in the same place to do very strong, aggressive sanctions against the Russians. The only cracks in that consensus are some of the far right members of the House and Senate who still to throw in with President Trump's pro-Putin stance. I mean, you've heard some of the things the former president said about Putin. Trump loves Putin, and Putin loves Trump for whatever reasons. But the overwhelming consensus among Republicans and Democrats alike is the strong sanctions aimed at Russian banks, aimed at Russian oil companies, aimed at Russian oligarchs, including Putin and his rich friends, going after their finances, and the sanctions going after their finances and going after their lifestyles. And that's the only way, because there's no way we're going to send troops. Ukraine probably can't defend itself. It's not probably, I mean, they're getting support from the West, but they're not a member of NATO, as you know. So I'm hopeful that it's a dark time for the world. This will be, if Putin does a full-scale invasion, it's the biggest military action in Europe since World War II. And Ukraine is a huge country, big in population, not as big as Germany, but big in population, and the largest country fully in Europe in area. So that's a real concern. So anyway, but thank you for your comments on ag issues and counted us to be there. It's a big part of my job is to work on ag. And I also didn't. I don't know if everybody in my office saw Mike King, you all know, Mike Services, who works in Darke County. John Ryan runs our state operation. Danny Carlson is on the call too, that does media stuff for our office. And she's on the call. I'm not sure anybody else in the office is. So, okay, good, thanks. Proceed, Katie, thank you.
Sure. Jason Kirshner is actually joining us by audio, but he wanted to give just a short update on broadband expansion. I know this is another one of a big priority for you. Jason?
Thank you, Katie, and good morning, Senator Brown.
Hey, Jason, how you doing?
I'm doing well, thank you. It's great to hear from you. And as Katie mentioned, I'm unfortunately not on video. Some ice down in Southwest Ohio gave me a little delay this morning, but excited to be here and speak with you and this group. So I am the government affairs liaison for Charter Communications. We do business as Spectrum in Ohio. And I wanted to talk just a little bit about some of the efforts on the ground in Darke County to expand broadband access. And I'm sure, of course, you're familiar with a lot of the action happening at the federal level and at the state, but wanted to talk about what we're doing here in Darke County to get everyone connected. So the Darke County Commissioners and the Economic Development Arm, Partnering for Progress, are really committed to ensuring that all residents have access to broadband. And we've had a great relationship working with the local officials on identifying where those unserved gaps are, and then identifying opportunities to plug those gaps. And I wanted to talk just a little bit about what those opportunities have been. So back in August, Spectrum entered into a partnership with the county to submit an application to the NTIA that would be for a broadband infrastructure grant to connect the large majority of the unserved population in the county. That application is still pending. We also submitted an application to the Ohio Residential Broadband Grant Program to connect unserved residents. And by unserved, we're talking about residents that don't have access to at least 25 by 3 download by 3 upload speeds. And so we submitted an application to the Ohio Residential Broadband Grant Program for the county, and that application is also still pending. So we know that access is a major contributor to the digital divide, but we also know that affordability is a contributor as well. So Spectrum is participating in Darke County. Eligible households in Darke County would be qualified for the Affordable Connectivity Program. We are a participant in that, as I mentioned, and actually when you combine the FCC's Affordable Connectivity Program, the ACP, with existing discount low-income programs like Spectrum Internet Assist, residents can actually get access at no cost to them. So we're working now to spread that information and make sure that folks know how they can sign up, how they can determine whether they're qualified. And again, just really appreciate the commitment on the local level in Darke County to working with providers to ensure that all businesses and residents have access to high-speed, reliable broadband. So I will end there, but I appreciate the chance to provide a few updates on what's happened at the local level.
Jason, thanks. And let me a couple comments about that. When Senator Portman and I and a bipartisan group of senators, I mean, we've heard presidential candidates talk for years now about doing real infrastructure, and finally this year we did it. And with Senator Portman and I and a number of people in both parties, it's water, sewer, everything from replacing lead pipes into people's homes with public transit, both rural transit and urban transit, And broadband was a big part of that. And we know that I think the pandemic taught a lot of people that might not have thought about it, how many holes there were in broadband. There's holes in inner cities, there's holes in rural areas, there's especially the lack of broadband coverage in places like Southeast Ohio that are poorer and more hilly and more rural. But I know in Western Ohio too, in Darke County and all up the western part of the state. So the investment in broadband is from the bipartisan infrastructure bill will be important. And also, I just wanted to let people know we are putting together different kinds of seminars, if you will. About 2 weeks ago, about 200 local officials, city, county, township trustees, county engineers, county commissioners, mayors. We set up a meeting with the Department of Transportation in Washington, as I said, about 200 Ohioans on how to attract these federal infrastructure dollars into Ohio. We also, through the infrastructure bill, we also did a similar kinds of thing with the Treasury Department. So if any, always work with my office when you're, and I know Doreen has with the community college and with many of you, we can certainly, I hope, open some doors. I want to make sure my job in part is to listen and find out what the needs are with infrastructure and beyond the Recovery Act and all, but also to then, after we pass it, make sure that it's implemented the right way and Ohio gets its fair share, or I like to think more than its fair share. So keep working with it. The other provision that I'm particularly proud of that Senator Portman and I worked on is strong Buy America language, so that when we build out broadband, when we build the Brent Spence Bridge in Cincinnati, or the Patterson Avenue Bridge in Dayton, or many of the little county culvert bridges. I grew up working a family farm near Mansfield, and you drive hay wagons over these little culvert bridges. There are literally thousands of them in Ohio that are in various stages of disrepair. So work with us on all of those, whatever we can do to help you in that way. But the provision, the Buy America provision, says no more building bridges with Chinese steel. If you're gonna use tax dollars for a bridge or a water system or broadband or whatever it is, you're going to use American products made by American workers. And that's an important component of this. So thanks, appreciate that.
Sure. Next, Christy Strasser. Christy is the Chief Executive Officer at Everhart Hospice here in Greenville. Christy.
Good morning, Senator Brown, and thank you for the opportunity for allowing me to speak to you this morning. I am going to kind of give an update of healthcare, and I think it can be broadly applied throughout multiple healthcare industries, and kind of give you a little bit of insight also into hospice and palliative care, which is my passion. And so a little bit about us. We serve 9 counties in Ohio with hospice and palliative care. We've been here for, we just celebrated 40 years last year, so long time. And I am also a nurse by first profession, so I've been a nurse for 18 years. I think that what we're seeing in healthcare, obviously, have not seen a pandemic in my lifetime, and what's occurring in healthcare is also something that we have never seen in this industry, and of course has us very concerned. And it's been a long 2 years working through a pandemic in the healthcare industry. So, some of the challenges that I'd like to share with you, speaking more broadly regarding the healthcare industry, of course, we have been seeing the not only the effects on the healthcare industry of serving those with COVID or affected by COVID, but then also seeing that at the same time, typically, when we're seeing a surge in providing healthcare to those with COVID, at the same time, we're also seeing a surge of COVID in our staffing, which has created just unspeakable challenges as we've navigated this, in how that applies every day in trying to provide quality healthcare for sure. Another concern that we're seeing is the financial challenges, the inflation of wages and supplies. has just been a huge challenge in the healthcare industry. It's also challenging in our line of business. We cannot often pass those costs onto someone else. So we're incurring those inflation. And for example, in the hospice industry, 97% of the patients that we serve are served with Medicare dollars. So we are reliant, Medicare gives us a per diem amount per day, and that is not something we can negotiate or change. So we have seen record inflation, for some of the other challenges that I'm going to talk about. We've had to increase compensation to retain healthcare workers, to compete for healthcare workers, and quite frankly, some days just to get them, to be able to serve and provide healthcare on a daily basis. Another challenge with those financial challenges is that some of the funds and revenue dollars that have been given and made available are dependent on showing lost revenue, and aren't necessarily capturing if you haven't had a huge loss in revenue, because we're serving all of those that are affected with COVID, and that's increased our patient care, but we're seeing that inflation in those dollars. That's not really being accurately reflected in some of the funds that become available. Of course, most have heard about the staff burnout with healthcare workers, and I will tell you that that is a very real thing, and that we're dealing with on a daily basis, and definitely feeds into our workforce challenges. This is related to covering COVID staffing, witnessing COVID deaths, in a way that we as healthcare providers have never experienced, working extra long hours. The term work-life balance is a hard term. It's used a lot, and right now being able to give that to healthcare workers as a leader in the healthcare industry is just a huge challenge. And also dealing with that trauma is difficult, because we're still actively going through the pandemic, so if this was something that had occurred and we could get all of the services to our staff to help overcome that, that would be helpful. But we continue to see this while we're going through this active pandemic. Also, the mass exit of the healthcare industry. We are not seeing individuals typically, we've heard great stories of some flocking during this time to help the healthcare industry, but the largest concern is that people are either retiring in the industry or are leaving the healthcare industry because of that burnout, and again, that this has been 2 years of navigating this pandemic. So that all kind of rolls into a term that I think we use a little bit simplified, which is workforce challenges. It sounds like a really easy thing to tackle, but it's not. And and where that's going to go in the healthcare industry is a huge topic for us, as we see lack of applicants and trying to currently staff the workforce. I think on a larger scale, we are concerned as a healthcare industry about what long-term healthcare looks like, and that pipeline of those coming into healthcare. So I think it's going to be important as we navigate that to come up with ways to create that pipeline for nurses and healthcare workers to be continually coming into this industry and taking away some of the barriers that we're seeing, such as not having enough nursing instructors in nursing programs. Really, several of us on this call will need to continue working together to navigate this and understand how to get more people into healthcare.
Can I ask a couple questions of her?
Absolutely.
And one of my first questions actually to Doreen. Doreen, tell me about tell me at Edison how successful you've been at recruiting your nursing program. How difficult it is. Is it easier, harder to recruit people into your nursing program? And or is it still 90% women, or are you recruiting more men?
We're definitely recruiting more men. We've increased our nursing program from 130 students to 180, and that's put us at capacity for our facility. So we actually have a capital ask at the state level, to expand the capacity. Out there in Darke County, we've had tremendous partnerships and been able to, like at the Brethren Home, we have an STNA class, that talking about that pipeline, trying to start with STNA, LPN to RN, all the way through to the BSN. So we've had, as Christy said, just, we really have some creative partnerships out there to broaden the ability for students to come in. We did at Edison this year, we did do the 25 and older free tuition, and that has all of the healthcare pipeline in there. So that trying to get, not only high school students, but maybe somebody who doesn't want to go back to services, customer service, to try to get them into the healthcare pipeline as well.
Doreen,
So,
you're not having problems recruiting students though?
No,
Good.
our issue is still, again, facilities. Facilities.
That's not the case everywhere.
And as Christy said, instructors is always an issue, but we have practitioners that are willing to step up and help us with instruction. It's like, I can't say enough about the partnerships out there.
Christy, my mother-in-law was a home care worker for years, and I know, and how important that job is. She wasn't a nurse, she was a home care worker. And with, you talked about wage inflation. Home care workers, what do you start them at in your agency now with after wage inflation? What is the starting wage?
Are you referring to like an aide or
a home care worker that's the lowest skill, not the registered nurse?
So currently we're starting them out at $15 an hour. And that was throughout the last year, the typical wage starting out was $12 an hour. So, we've increased that by $3 over the last year, and really have had to move all clinical, as it's became a competitive market, to compete for that. So we've had to move RNs, LPNs, aides, everyone has in those roles, at least $3 to $5, an hour move for starting wages. And one thing I'll add is it's exciting to hear of new nurses and those nursing programs. Another challenge is getting them to stay in our rural area, because of wages and capacity. For example, as a smaller nonprofit organization, not a large healthcare industry, trying to compete with, a larger healthcare provider to compete for them to come in, or not go to travel nursing, and also agency, wages, they're flocking to agencies. So, those add dynamics into.
Yeah, okay. One other question, and Diane, you might want to weigh in on this from here if you'd like. Yesterday, I met with the governor's health director, Dr. van der Hoef. He said that literally 95% of COVID deaths in this state have been people who are unvaccinated, and he wasn't quite as clear, 90 to 95% of those who are hospitalized are unvaccinated. So talk to me, if you would, about Darke County vaccination rates and any of you weigh in on this that know this, vaccination rates, particularly rates of vaccination in healthcare facilities, whether it's your not-for-profit home care agency or whether it's the hospital or any of these offices, how and I know that there was the federal requirement that healthcare agencies, at least hospitals, and then someone challenged it in court, the court upheld it, to require vaccinations. In the hospitals, the big city hospitals, some of the Cleveland Clinic never did it, which is kind of amazing. In University Hospital, some of the big hospitals never did. Some of the small, big but smaller hospitals like Metro in Cleveland, Summa and Akron, Mount Carmel, a Catholic chain in Columbus, they ordered vaccines for their employees and they had very, very, very few people quit. So talk about what your experience has been in Darke County and surrounding areas, if you would, on vaccine requirements and vaccine, just what percentage of people are doing it, whatever you can tell me there, and whether it's Diane or Christy or anybody else that can speak to that.
I'll let Christy go first on Darke County, but then I'll be happy to chime in after that.
Okay, sure.
Yeah, we've been very blessed in our organization. We did move forward when the CMS rule had came down. By the time the injunction occurred, all of the hard stuff had, already occurred. So we just moved forward with that. And we're very blessed that, we did not have a mass exit of staff and Diane can speak to, how that has affected the larger hospitals. I think certainly it's been no hidden fact that, Darke County's vaccination rates are very low. And so we see that, when going back to talking about that staffing effect, in January in one given day, we have roughly 106 employees. Every day we had at least 15 staff out with COVID. So when the community is surging, that affects our organization. So I'll let Diane speak to to her industry.
So thank you, Senator. Good to see you again. And Christy described this really well. We did require vaccines for our entire health system, as did really the whole Dayton area. There's been a lot of collaboration between health systems, which has been one really good thing that's come out of COVID. There is no question, though, that the main reason we have lost employees, similar to what Christy said, is because of burnout. We did lose a small number of employees because of the requirement, but we have over 13,000 people, so that was probably not unexpected at all. But the burnout is just a tremendous issue for us. As far as vaccination rates for our patients, it's been all over the map. Omicron has changed that a little because there's been some breakout cases, even with vaccinated folks. But no question that those who are dying and those who are in the ICU particularly, it's a very, very high rate of unvaccinated patients. And it is just tremendously sad. I would also tell you that has been an issue for our staff. We're in the business of healing and keeping people safe. And our nurses and respiratory therapists and anyone on a COVID floor, to understand that they have patients who are dying that in their view might have had a better chance if they had been vaccinated is very hard emotionally, because that's what people, we want to heal people. So that's been quite a challenge through the whole time. But you described it very well, Senator. It is, if everybody had been vaccinated, quite frankly, other than people who couldn't because of their physician telling them not to, or many with, a very strong religious exception, if everybody else had chimed in, quite frankly, we would probably be in much better space.
Yeah. My dad was a general practice small town doctor in Mansfield, and his my brother was born in 1947, and I tell you that only that when the polio vaccine came in the early mid 50s, my brother, some public health people, I don't know who decided this, but that it would be a good idea for doctors, if they had first and second grade kids, to stick the needle in their arm in public, essentially, and so the newspaper could take a picture of it. My brother's picture is in the paper. My first grade older brother's picture is in the paper getting a shot from my dad. And I mean, most of you are not as old as I remember this, but polio, there was such a fear and virtually everybody wanted to get vaccinated. And I mean, I think back a year in 13 months when the question was, I remember Biden said on his inauguration day, he said, we want to get 1 million shots a day into people's arms for the first 100 days of my presidency. He ended up doing about half, again, more than that at the beginning. But the challenge at the beginning looked to be, can we manufacture enough of these vaccines and can we scale up the distribution of them and the shots? And do we have enough doctors and nurses and the infrastructure in cities and rural areas? And then, a third of the country decided they didn't want to do it. And it's been such a challenge. So one other real quick story. I was talking to a guy from United Airlines, and United Airlines has 71,000 employees, and they ordered the vaccine really early, almost as soon as it came, not quite as soon as it came out, but as soon as they knew they could get enough, they required it. And anybody that didn't get it, they had 60 days or whatever, they would lose their jobs. And they only 200 people out of 71,000 left because they just realized I like this job. And I think it's a bit of a myth that people are going to bail out. But what you both said, Diane and Christy, about burnout, I just can't imagine. I mean, every nurse I've talked to, every healthcare provider, respiratory therapist, anybody who works at hospitals and is exposed to patients with COVID, and just the pain of watching this and seeing this and having to delay other medical procedures has just got to be, I know they went to school for this, but not really quite for this, right?
And Senator, if I could just add one thing, the other thing that has been such a stress on the employees is that many of the COVID patients, as you know, did require one-on-one nursing. So where an RN, for instance, in any of our hospitals might have had 3 to 4 patients, they were now needed to have a one-on-one situation. So from a staffing standpoint, that just exponentially made the problem that much worse. So there have been a lot of things, and to your point, we're filled with people who need other care than COVID, and that's the other stressor in our communities, because and not being able to take referrals for a long time because we were so filled. And Miami Valley Hospital is the 15th largest hospital in the country, so it's a big place. And we were at that situation. So thank you for asking and listening.
Thanks for your insight.
So Senator, this is Dr. Doreen Larson from Edison State. Always a pleasure to see you. I'm the final speaker on the planned agenda, and I know then others will be open for questions. So again, I appreciate the time, and I have my colleagues here, and as I said, our partners from Darke County. So you mentioned the enrollment at Edison State. I'll take a moment again to highlight that unlike most of higher ed, Edison State has increased their enrollment prior to the pandemic and throughout the pandemic to where we're at record enrollment. And I think, again, just as people consider what the secret sauce is, it's in the title of our presentation. Edison State is presenting on education and workforce. We consider those one. We consider that a single mission. We don't bifurcate our workforce programs from our other types of programs. And again, I would encourage any approach on the federal level in that regard as well to blend workforce and higher ed together. And you've certainly done some of that, but that is the secret sauce at Edison State. We have always considered that one mission and partnered in particular out in Darke County with our business partners and healthcare and manufacturing, offering whatever training is needed in whatever format is needed, wherever it's needed, and certainly that has sustained us. So we actually found we found the COVID situation an opportunity to promote Edison State, and we had a program that prevented students from stopping out between high school and college. We provided free tuition for those students so that they would not stop out. And in the course of that, then we introduced them to careers and apprenticeships and careers, especially out in Darke County. So right now we have an initiative for, again, adults 25 and older who are going into accelerated and short-term programs. We're waiving tuition for them. We're seeing a tremendous response there. And we're able to leverage some of the short-term Pell funding from the state, and certainly grateful for the short-term Pell support that you and Senator Portman have provided. Again, anything in that direction I feel is very, very helpful, and helpful for the future of the state as we look at, things on the horizon like Intel and those types of issues as well. Not trying to set aside workforce to a small segment of any college or anything is just not going to get the job done. So we, again, like to share our success story, and also just mentioning, again, support for short-term Pell, and also any type of a digital wallet. And I had a chance to talk with a couple of your staff last week. They were excited about the idea of, again, blockchain technology and digital records, especially for students, that they would then be able to have portable records and not have those beholden to institutions. So be happy to provide any support for that initiative. I think it would, again, set Ohio ahead of the game with portability, and all of that contributes to workforce.
Thank you, Doreen. A couple of questions. You've been Edison 6, 7, 8 years. When did you start? I can't remember.
7 years.
7 years. We do something that Doreen has been helpful in every year. It occurred to me early in my time in the Senate, as I was doing roundtables around the state, that colleges didn't always know, the college presidents at, say, Sinclair or Edison State wouldn't know the people at Ohio State or the people at Denison. So we began back in about 2008, and Doreen's helped us with this. And since she's been at Edison State, we began these college presidents conferences. We have about 40, between 40 and 55, depending on the year, college presidents come to Washington. No staff, just the presidents. We keep it intimate, and they really do. We bring in, Rob almost always comes to it. And I bring in both the Republican and the Democratic leaders and the education committees, and it's really been helpful, and it's taught me a lot and taught my staff a lot. And so we're going to continue that. So what it does say is that Doreen and her colleagues know a lot more about the other schools in the state as a result. So my question is this: while you've been able to scale up your nurses training, I found I met with a bunch of police officers and teachers and firefighters this week on just Zooms like this, and there were particularly those professions, police and teachers, I don't think have the respect they used to in the community. Not really because of anything they've done. It's just the society, whatever the reasons. So there is the burnout in those jobs that Christy talked about with nurses. But there's also we're not attracting enough young people that want to teach. We're not attracting enough young people that want to be police officers. Some are leaving early. That's a part of the problem, but we're not filling the pipeline very well. So could you just, with your kind of large view, I know you went to school in other part, I think you went to Kent, if I remember, where my wife's.
You're right.
And you just any overview of what you see on training of public workers, whether it's public healthcare workers or nurses or teachers or police officers through the community college and other networks around the state?
Yeah, it's a great question. Something that we don't experience. I think it's Midwest. I guess it's rural, but in our area, certainly that respect for firefighters, police, and teachers is still extraordinarily high. So there is there's still within I would say my service area, there's still a lot of high regard. There's interest there. I thought maybe someone had teed up this question because we do an apprenticeship program with the firefighters in particular, where young men and women can apprentice, and then through the apprenticeship and I think we're unique in that regard, but then they get points on the social service exam that again puts them right when they go into work at a higher level, higher pay level. And I believe we have about 30 fire departments now that participate in that apprenticeship program through Edison State. I would say teacher education is the issue that's on our radar. We're trying to solve. The community colleges don't necessarily, we do the pre-work. We're trying to, right now, we do have a pipeline with Upper Valley. It starts at the career tech area, trying to, again, we actually house that program here at Edison State to, again, encourage more students. But that, I would say that is the challenge. I think that's going to be the new, a partnership that's going to have to go between the 2 and 4 years. To get especially diverse populations into teacher education. It is one of the priorities for the Chancellor of Ohio, Chancellor Randy Gardner, keeps that front and center with all of the colleges. So we're trying to, again, get creative, but we're looking for models there. Edison State is looking at one of the cradle to career models that are in the metro areas. I think that's how it has to be. There's some family values there, but that's good. Like I say, firefighter, police, we're doing well. The teacher education is tough, but I think we'll get some good partnerships in there, but that is certainly a challenge.
Okay, I know, Kate, I know we were supposed to go 45 minutes. I'm willing, since nobody but the sort of the 4 designees got to say anything or ask questions, I'm willing to stay on another 10 minutes or so.
Sure. Senator Brown, this is Peggy. Katie had to jump off. She has jury duty today. So she had to run. I just wanted to give, our Sheriff Mark Whitaker is on the call. I didn't know if Mark wanted to say anything in response to that question as well.
Sure. Sheriff, how are you?
Good morning. Appreciate the opportunity. Law enforcement, definitely in Darke County, because we're a rural county, is having significant issues with recruiting and retaining folks. The biggest challenge is getting qualified applicants in law enforcement. We can't just take anybody in this business, nor do the citizens of Darke County want me to take just anybody in this business. So currently, the Darke County Jail is down 6 corrections officers. I should have like 20, and I do not. I'm sat down by 6. I'm down 3 911 dispatchers, emergency communications. That's made things challenging. And then, of course, naturally, just like everybody's already mentioned, those types of staffing issues create a burden on those that are working for me, because now they have to work double time. And with the younger folks coming in, as we're all learning, their time off is important to them. So we're kind of in a catch-22. But I would agree that maybe not so much in Darke County. We're a little different than the larger cities, but there is an overall negative view of law enforcement that I think is impacting young folks wanting to get in. And then some of it is pay oriented, but the law enforcement business really is a calling for most folks. But when they see some of the negativity in the media, that seems to drive off the young folks. But we need to do a better job in that area. A lot of our certified peace officers come from Edison State's Peace Officer Training Academy program. So I do appreciate that academy being nearby and at least giving us some opportunities. Those are the challenges that I have from a recruiting standpoint. I have a couple of other concerns, but I don't want to take up too much time.
Sheriff, I was actually going to ask you to speak. That was one thing we didn't have on there, is anything about our opioid or healing community study. I didn't know if you wanted to speak briefly about what's going on there or what you're seeing on that as well.
Right. Well, first of all, Darke County benefited from a large grant, actually, called the Healing Community Study, and it is about to come to an end, but it provided financial resources to us to provide some innovative approaches to the opioid use issue that we have, and it's been beneficial. We have tried to identify ways to keep that going. sustain that. And I think we have some ideas that locally we can do that. But as we move down the road, we want to take advantages to a variety of sources that I think are going to be available to us through grants and things, additional grants, so that we can offer these opportunities. I went ahead and took the challenge of providing medication-assisted treatment. It is limited, but I do provide it in the jail to those with substance use disorder. And I don't want to do it with general fund local tax dollars. The citizens don't want me to do it, so the grants are important for me to continue that program going. I will say, as far as opioid use disorder, we have, obviously, just like every other community, a serious drug problem. So Senator Brown, I would ask you to keep that in mind. I believe that stronger border security is an important part of that process to stop the supply from coming in. And, you know, the other things that's just important to us, because I believe that's part of, we have to balance enforcement with providing assistance to those who've already arrived at the point of having the use disorder. So we got to kind of go at it both ways.
Well, that interesting you say that. Senator Portman, there's still a number of us that, well, back up on during the pandemic. One of the other tragedies of the pandemic, one of many, was that the society sort of lost its focus on opioids, and opioids got worse, just like child abuse got worse and violence against women got worse during the epidemic. And we were so, of course, as we should have been a society, focused on fighting the epidemic, that I think we let slide a little bit too much, keeping fentanyl off our streets and keeping and getting the medication-assisted therapy that the Sheriff Whitaker mentioned. So there is still, from a number of us in the Senate, and Rob and I are two of them, that to keep the focus on what we need to do with opioids, so especially fentanyl, and giving the tools to law enforcement and making sure that treatment facilities, there's just clearly not enough treatment facilities. These are addictions. These are maybe they're human weaknesses in some part, but they're addictions and they're health issues and they're mental health issues. And we simply haven't paid enough attention, but thank you, Sheriff. Anybody else want to add anything before we head out? And tell Christy thanks for her nice comments about Mike King, by the way. So certainly calling Mike. John Ryan, as I said, was on the call. He runs our state operation, or reach out to me in the future on anything you need. Is that it?
That,
Anybody?
I think, is it. Did somebody have a question?
No, I just have one comment. This is Dr. Holman,
Oh,
Health Commissioner. We talked about a variety of things, and we've kind of alluded to the opioid crisis, but mental health has also been a big issue for a variety of reasons. And I won't get too far into that, but Terry Becker was on here from the Tri-County Board. I don't know if she still is or not, but being able to service mental health has, I think, been a challenge too.
Well, we just don't, and we haven't had this, as you know, Dr. Holman, we haven't had the state investment for years in public health, and especially mental health services, that we need. And it's just as big a problem in rural Darke County as it is more urban Montgomery or anywhere else we know. So thank you for speaking up on that. All right.
Thanks for listening to us.
Sure. Thanks, everybody. This was very eye-opening and helpful and informative. So good to see you all. And thank you for all of you patiently sitting here for an hour and listening to us talk. And thanks for your input, and especially thanks for serving a really good community. And one of these days I'll see you again at the great Darke County Fair. So thanks, everybody.
Thank you so much, Senator. Thank you.
For sure. See you, everybody. Thank you.
I'm just going to take a second to thank everyone. I want to certainly thank our speakers from Mike, Jason, Christy, and Dr. Larson. I think we all want to see the mug. We got to see the mug. No, okay, there you go. Oh, okay. It's like she's drinking out of a whole coffee pot. That's some serious coffee, or is it tea?
Let me get unmuted here. It is a coffee mug my husband seemed to find, but it kind of looks like a landmine too. That's too funny.
Thank you for that. Every time it went by, I was chuckling to myself. So a couple of things we have coming up real quick at the chamber. We have our March 18th, we'll have a tech cred program. Be looking for that. Ag Day, March 25th. And then very excited to be working with Edison State and Economic Development on our impact conference for girls looking for STEM careers right here in Darke County. So very excited about that partnership. Lots going on, lots in partnership with lots of our great things. So go forth, as I always say, do good work and have a wonderful day, everyone. And we will see you again soon. So
We got the coalition meeting tomorrow.
yes, sir.
See you in the morning.
All right. Thank you all.
Thank you
Thanks,
so
Peggy.
much.